I hurt myself today to see if I still feel. That song is from Johnny Cash, and those words were in my head as I walked down the psychiatric unit to see a young woman named Lisa, 22 years old. The report I'd been given is that she'd been cutting her wrists and her thighs. I knocked gently on the door, opened the door, said, "Good morning, I'm Dr. Gooderson." "Get out," she screamed. There was no ambiguity in her voice. Rage, panic, defense. And so I backed out. I've learned long ago that force only deepens the trauma. And so I complied. The next morning I returned, this time with a female nurse with me, hoping Lisa would feel safer and less exposed. I opened the door gently. She was sitting cross-legged, her back to us. I said, "Lisa, I just wanted to say," and before I could say another word, she said, "Get out, you asshole." She didn't scream it this time, but it had more poison to it, as if she'd been storing it up all night long. And so again, I complied. The next day, the same. Lisa, she wasn't coming out of her room, so we're bringing her food to her there in her room. Staff said, "Dr. Gooderson, we need to pressure her, to push her." But I said, nope, we're going to leave things be. Lisa had built up a fortress, and there in her room, she sort of felt safe. We were going to respect it and wait. As the day went on, I was thinking a lot about Lisa, and something was really gnawing at me. I realized that the cuts she had made were not just physical cuts, but of course they spoke of unspeakable pain. To look at your body and to see cuts in yourself, to see cuts which represent failure, shame, and abandonment. And as I thought more and more about abandonment, a certain question came to me. The question was she adopted? And so with that in mind, the next morning, I knocked on her door, opened it, and from the doorway, I didn't say good morning. I just said, "Were you adopted?" She turned and looked at me. Her eyes were like knives. She paused. There seemed to be a brief unraveling. She said, "How did you know?" I didn't have time to answer because she yelled out, "Now get the F out." Borderline personality disorder. Borderline personality disorder is one of the most commonest diagnoses that we see in patients there in the psychiatric hospital, because what happens is they will do things to hurt themselves, put themselves in danger, and that buys them an admission to the psychiatric hospital. Borderline personality basically has 9 symptoms, and if you have 5 of those, and if they disturb your functioning, your ability to be in the workplace or your social functioning, then you so-called qualify for the diagnosis of borderline. Number 1, frantic efforts to avoid real or imagined abandonment. For those of you who may remember the movie called Fatal Attraction, when they were about to depart after the weekend, she cut her wrists and was bleeding as she kissed the guy she was with, and that kept him around. Fear of abandonment. Number 2, a pattern of unstable and intense interpersonal relationships, that they idealize somebody and then quickly they will devalue them, sometimes actually in the same conversation. Number 3 is identity disturbance, to have a very unstable self-image, not to know who one really is. Number 4 is impulsive behavior, getting involved with some dangerous things, overspending, sexual improprieties, substance abuse, reckless driving, and binge eating. Recurrent suicidal thoughts, making threats, and self-harm, self-mutilation. It's what we call emotional dysregulation, having very marked reactivity to those things that are going on around. Number 7 is chronic feelings of emptiness, yearning for attention, feeling easily bored. Number 8 is inappropriate and intense anger, even at the slightest thing. And number 9 is stress-related paranoid thoughts, or to the point of having dissociations. These 9 are the cardinal symptoms of a borderline personality. And so it was the next day, again with a female nurse by my side. Lisa led us into her room, into her world. She looked right at us and said, yes, I was adopted at 2 months of age. I never met my real parents. And then she opened up. She started talking about a whole carousel of failed relationships, men who had abused her, women who had mistreated her, therapists who were looking at their watch more than really listening to her. Tears were streaming down her cheeks as she shared more and more. And then she turned to me and she said, can I trust you? I knew that trust does not come easily, and trust does take time. I said, yes, you can trust me. And so later that day, I thought some more about Lisa. I thought about a little infant, not yet 2 months old, being held, but not by her mother, but by nurses. Nurses who cared, but still they were strangers. No maternal skin, no warm breast, no cooing voice, just a void. I thought about the saying that words from the heart go to the heart. But what happens when you're simply handed over? We know that a soul comes into this world with a particular mission. But what happens when your soul comes into a world that's in shadows? Lisa's pain wasn't just psychological, it was spiritual. And there she was, an attachment never formed. Hurt myself today to see if I still feel. I focus on the pain, the only thing that's real. And so the next morning, as I approached Lisa's room, I had some hope inside of me. We could build on what had happened the day before. We could talk about how trauma affects the neurons, or maybe how hurting oneself is an attempt at feeling alive. Or we could just sit quietly. I opened her door, said good morning. She was sitting there looking at me, her eyes blazing. And she yelled out, "Dr. Asshole, get the hell out of here." I stood there, not angry, not disappointed, just still. Because I realized that healing is not linear. It takes time. Like old doors that open slowly with a lot of creaks and a lot of resistance. And sometimes they just slam the door shut on you once again, hoping that maybe you'll still come back.